What's up, everyone? Welcome back to episode 7 of Kind of Different, a podcast where we talk about innovation. We connect with some amazing people in dentistry. There's so many of us. And we really get to think about how we can make dental care more human. Really, really excited today to have Hayley Buckner with me from Elevate Oral Care. Hayley is the professional relations manager at Elevate, and really, I've gotten to know her over the last few years. Both her as a person and Elevate as a company are doing some really amazing things. So Hayley, thank you for taking the time to join us today.
Yes, thanks so much for having me.
For sure. Well, Hayley, before we get started, can you tell our listeners a little bit more about you and who you are and what you do at Elevate?
Yeah, absolutely. So, as you said, I'm Hayley. I'm the professional relations manager at Elevate Oral Care. I've been a registered dental hygienist since 2009, and I've been with Elevate for about 6 years now. And I get the opportunity to work with some of our industry's key opinion leaders. So, really, the kind of forward thinkers, the people that are out there, much like yourself, that are really innovating dental care and trying to make it the best it can be for patients. And so I get the opportunity to work day in and day out with those leaders in the industry and kind of share who we are at Elevate, which is a prevention focused company. We have a full line of preventive care products for use both in office and at home. And but much more than that, we create these innovative products, but we truly pride ourselves on education, and we want to bring the latest in prevention, caries risk assessment, patient-centered communication, all of that good stuff to the dental offices that we work with. So we really pride ourselves in that education component as well.
Which you all do a fantastic job. And just as a disclosure, right, for those of you who may have listened to other podcasts like Tale of Two Hygienists, some of those podcasts, Elevate does sponsor some of those. I think I've definitely heard Steve on this. Elevate is not sponsoring this. We simply said, hey, we really believe in what Elevate is doing, and we want to highlight Hayley and the message that Elevate has. So just so you all know, this is not no one's paying for any of this. This is all because we simply believe in what Hayley does at Elevate and Elevate as a company. So we'll make sure we put that out there before we get started too. Cool. Well, Hayley, we always love to let our guests kind of choose where we start. So innovation, connection, making dental care more human. Do you have a specific kind of area where you would like to begin?
Let's go with making it more human.
Okay, that's a great spot. I love that one. I always like seeing what people pick there too. So cool. So I think let's start off super actionable here. Sometimes I feel like we start off very theoretical or kind of 30,000 foot view, and then we get to actionable. But let's start off super actionable. You are a registered dental hygienist. You have spent a lot of time in offices. You have been training and helping people learn for a long time. What's one small actionable thing that you think dental practitioners could do to make dental care more human on a regular basis? Like, hey, most appointments do this thing, or try this, or whatever it might be. Give us some insight there.
I think that the biggest thing, and it's kind of a bigger just tip, but just caries risk assessing patients. I think it's critical for us to kind of have a baseline at each visit as to where our patients are, because we're there to provide them with healthcare.
Mm.
So we want to make sure we kind of have that baseline and develop that conversation with the patient so that they understand what their baseline is as well, and how we can get them, in between visits to maintain their health or improve their health. And we can only do that by first starting off with that caries risk assessment and being able to identify where they're at, and then communicating with the patient where they're at, and understanding what's important to that patient, what they value when it comes to their oral health care, and how we can work together with that patient to get them to where they want to be,
Mm.
and maintain that for them throughout their life with us. So I think if everybody could really take that time to spend a couple of minutes, and it really can just be a couple of minutes. I think that's one of the biggest barriers, is people are a little intimidated on how much time it can take, rightfully so. We all only have however many minutes with our patients. So that's one of the things we did at Elevate, is we've actually worked closely with you to develop a really simplified caries risk assessment form, and it really incorporates the patient in there as well. There's lots of caries risk assessment forms out there, And a lot of them are very, very detailed. And like I said, we just kind of simplified it so that we can incorporate some open ended questions to really, again, understand each individual patient for who they are and what they value. And then, of course, those necessary kind of close ended questions to identify some of their habits that could be putting them at risk. And then that really kind of works together with the patient to have a great conversation flow. And then we can help them to make we can make some recommendations for them, chair side that can work, and then we can send them home with different tools and products to help get them again healthy until we see them again. So I think really kind of taking that just couple minutes to risk assess a patient is going to make all the difference in the world.
Totally, totally. And I mean, I'm sure you probably have the data on this. I don't have it off the top of my head, but I mean, I think I want to say it's like 80 some percent of patients are like moderate or high risk, right? In general. And even if we, recommend a simple, idea of, hey, here's a 5,000 part per million toothpaste that you could use. You don't have to do anything different. You're just like literally brushing your teeth and then spitting and not rinsing, right? That can make a huge difference, but we have to first know that that patient is at moderate or high risk so that we can say, hey, let's talk about this potential intervention. Would you be interested in something like that if we think that that might be helpful? So yeah, I think that starting there is a foundational piece of us treating dental caries and periodontal disease and all of those things as a disease and not just the kind of symptoms of the disease, if you will.
Yep. Yeah, totally good. And you're exactly right. I think it's like 85.5% of the population has an increased risk. And we know that's only increased during the pandemic as well. So yes, if we could just do that simple thing and it just kind of helps build trust with our patients as well. It's like, wow, my healthcare provider took the time to ask me some of these questions and ask me what's important about this and how I can change my habits to improve my oral health and of course overall health in the long term.
Totally. Yeah, for sure. Well, and I love that it's in this section of like making dental care more human, right? Like the tip is not, hey, like know your kid or know your patients like kids soccer schedules or whatever, right? Which is like, that's fine too. But like if we're focused about what we're talking about when it comes to improved oral health, that can be so life changing for people. And that really, people are there to really see an oral health care provider. And it's great that they might know about your kid's soccer, whatever it is too. But if we really want to help people, improve their oral health, we need to be focused about that. And I love that that's, hey, this is a way that we can make healthcare more human with some very kind of, hey, what matters to you about your oral health, not just what matters to you in general, right?
Absolutely. Yep.
Cool. Well, one other question kind of in this section that I would love to ask you about. When you think about, some of the things that you see out there, you guys are obviously focused in a pretty specific area, right? And you have been for a long time. And I want to ask you about that in a minute too. But what's something that's out there that you feel like is overlooked, but that is really impactful? That could be on the patient side, that could be on the practitioner side, wherever it might be. What's something that you think is important but overlooked as we think about making dental care more human?
Again, I kind of think that ties in with the caries risk assessment and really just asking those questions to our patients. What is it that they value and what are they striving for? Why are they in there for that visit today? And, once we understand that, then we understand how to better treat the patient. So kind of really just taking that time to, like you say, almost make it more human and it's okay to have a conversation with our patients. And that way we understand who they are and what's valuable to them and that way we can certainly make those recommendations for them based on that. If we're making recommendations that they don't value at all, then it kind of misses the mark and they leave and nothing probably changes for them. So I think really taking the time and just having that little bit of a conversation with patients is going to make a big difference for them.
Perfect. So not only are you seeing it as overlooked, but it is kind of your big tip, right? So you're like, hey, I don't think enough people are doing this. And if I had any recommendations for you all, it would be to just take the time to have that short conversation to hear your patients are. So both of those questions answer the same answer. I love it. Cool. Well, let's talk a little bit about innovation because, like I just mentioned just a minute ago, you all have been innovating in the oral health care prevention space for a while now. For those of you who don't know, Elevate makes silver diamond fluoride and has really helped bring that to the U.S. market in lots of cool ways. Done lots of amazing education around that out there. You guys have a number of other things that you produce as well that are really innovative, and some of which that are just coming out. I'm super excited about. It's a really interesting space to innovate in. There's lots of innovation around kind of tech gizmos, right? Like things that dentists can use, like CEREC machine, which is very cool, right? Um, but like, talk to me a little bit about innovating in the prevention space. Why has there been such a commitment to that from you and from Elevate? And how do you feel like that makes you all unique and in the space that we're talking about?
Yeah, so Elevate has a pretty long history when it comes to prevention. The owners of our company used to own another prevention company a while back called Omni Oral Pharmaceuticals, where they were leaders in prevention at that time. A couple years back, well, back in like the early 2000s, they sold to 3M, and then our owners came back and started Elevate Oral Care. So prevention has been a passion of Elevate for a very long time. But when you think about it, you mentioned some great technologies that are out there that are innovating in the space of dentistry. But if we don't have prevention, those, fancy technologies or fancy restorative treatments, those can fail for patients. So, it all kind of starts back with prevention. You want to make sure you're preventing dental disease from ever taking place. But of course, there are times when you're going to have to restore for patients. But again, then we want to have that prevention aspect to keep that restorative work or that implants healthy so that we don't have failures down the road for any of these other awesome restoratives, technologies, anything that else that's going on in dentistry. We want to, it all really begins with prevention to keep everything as healthy as possible. A lot of people, spend a fortune on these investments in their mouth, whether it's with ortho, anything, restorations, like we talked about, all that. So it all comes back to prevention. And that's why we're really so passionate about prevention and bringing prevention products to the market, but ultimately educating people on prevention and the latest knowledge that's out there so that they can pass that on to their patients and hopefully have healthy patients.
Yeah, I love that. Is there anything that's like new in the prevention space that you can share with us that you like been working on, or anything that's we're like, hey, we're about to release this, or we have this coming out, or you guys seem to have something really cool that is coming down the pike often. So I wonder if there's anything you can share that's going
Yeah.
on.
Yeah, you mentioned silver diamine fluoride. We've got some exciting advancements coming up here with silver diamine fluoride in the near future. All day, we've got our all day dry mouth spray that is an awesome dry mouth spray for patients. It also is not only treats the dry mouth and helps soothe those tissues, but it also contains like 44% xylitol. And that one, we're getting ready to launch a gel and some other products. So that line will be expanding here very soon. And then also, we've been working on a povidone iodine, which will, povidone iodine has been a well-known antiseptic product over the counter, available for years. We'll be packaging them in our little unit dose fluoride ampules
Mm.
so that it can be applied chairside, and then patients who are moderate to high risk for caries can use it at home either monthly or every other month, depending on their risk level. And that really helps control plaque buildup, and in the long run helps with inflammation and caries. So that's an exciting product that's getting ready to hit the market fairly soon as well.
That's awesome. Yeah, I feel like I've seen some of the like clinical research around that, and that's cool that you guys are able to bring that to market so quickly. Well, and maybe so quickly as because I know people like have been using that for a long, long time, right? It's not like, oh, here's this like brand new thing, but something that's maybe been forgotten, another overlooked thing, I guess, if you will, that y'all are bringing back. I love it.
Yeah.
Yeah, and one of the kind of questions here in terms of innovation, like you again continuing to innovate in this preventive space, but obviously you want to see an impact there. I think kind of like you just mentioned, right, around, hey, no matter what, whether that's just preventing dental disease, which by the way, happy World Oral Health Day yesterday.
Yes.
I saw lots of the kind of gifs and memes out there of, hey, like this is a totally preventable disease. It totally is true, and you guys are working hard to make that happen. But ultimately, when you are all setting out to kind of innovate in this prevention space, it's with the patient in mind, with the providers in mind, right, to help everyone. But is there a specific kind of like impact that you're all seeking? Are there metrics around that? Is there some sort of like, hey, here's what we hope the impact of like staying true to our preventive focus will be?
Metrics wise, not really, but we just want to spread prevention as much as we can, minimally invasive dentistry. So yeah, we just try to, um, you know, get the message out there as best that we can, whether it's through continuing education courses that we host on our platform every so often, with our preventive care consultants throughout the country who come into offices and do continuing education staff meetings, all sorts of different avenues and ways that we can work with, again, the industry's leaders and those big researchers to kind of bring the latest news and information in prevention so that we can all be doing the best by our patients as possible.
I love that. I mean, I think it's one of those things where they like talk about it in dental school, it feels like, or dental hygiene school probably. But that's a huge impact, right? Of like, hey, we are only going to focus on this and we want to help people understand like how it can be part of your day-to-day practice. That's a huge piece of what you're all doing, is at least from my perspective. So thank you for doing that. I love that. Well, cool. I want our listeners to understand a little bit more about you as well, right? You're just, I really, like I said, enjoyed getting to know you over the last number of years and have always just found you to be so thoughtful. And so tell us, something that you're super proud of, like something, it could be related to Elevate. It could be just, hey, like not related to Elevate at all. But tell us something that when you look at your life, you're like, I'm really proud of this.
Well, I mean, first and foremost, my family for sure. I have three small children, 6 years and under. So, of course, my children are what I'm by far the most proud of. And my family, my husband and I just have so much fun raising our three small children. And then I just love the flexibility that I have with Elevate. I'm
Mm.
fortunate enough, I work from home, so I get to see my children a lot, but I also get to travel a lot and meet with a lot of these industry leaders at different dental conventions, throughout the country. And then I get to learn from these experts, the latest and greatest that's out there. And then we can kind of work together to share our message that elevates promoting of prevention and things like that. So I'm most proud of, I'm I just everything. I mean, I love what I get to do day in and day out. I love getting to work with the industry's leaders. I love spending time with my children, and yeah, I mean that's my definitely most proud of my family life. But work life is just I have such a great balance with it all. So
Mm.
it's all been very fun.
That's great. Yeah, I was just gonna say, it sounds like you found a really good balance of like, hey, here's this like very rewarding career, and as well as allowing you to be present with your family, which is so important.
Absolutely, yes, definitely.
Cool. Well, to kind of, obviously, as someone who has three young children as well myself, that can take a lot out of you. And I think we all have realized through COVID, like the value of finding time and space to recharge and regenerate and whatnot. When you're feeling a little bit stressed or burnt out or overwhelmed or, frustrated or whatever that might be, how do you find solace and regeneration and refreshment? Give us something that works really well for you. Maybe there's one of our listeners there who's like, yes, I love that. I'm going to take that and seal it and go find some solace myself.
Yeah, I wish I had really good advice there, but I think the biggest thing is fresh air, getting out and walking, with your loved ones and just soaking in that fresh air. It just kind of reminds you that, okay, yes, this is a stressful time right now. There's a lot going on with this and that, but at the end of the day, we're all living this beautiful life, and I think just getting out and enjoying that fresh air with your loved ones is the best way to kind of regroup and refresh and get out there and start over again the next day. So my little tip.
I love it. I love it. And we're coming into spring. We have the start of spring this weekend. So yeah, 100%. Hopefully we'll all have a little bit nicer. It's snowing out here today outside of my windows, but hopefully we'll have that nicer weather to more easily get out into the outdoors as well.
Absolutely. Yes. You're dealing with snow, we're dealing with pollen. So,
Everyone's got their challenges, right?
that's right.
Everyone's got their challenges. All right. Well, Hayley, if people want to find out more about you, if people want to find out more about Elevate in general, or specifically, hey, who's my rep? How do I get in contact with you guys? I've been thinking about using silver diamine fluoride or whatever that might be. How, share with us some information on how they can get in contact.
Yeah, very simple. Just visit our website. It's elevateoralcare.com. You can request a staff meeting right from that homepage. You can put in your zip code and it'll direct you right to who your rep is. And then also kind of take your time looking around. We've got a whole little resource section where you can find some of the latest CEs that we've brought from industry leaders. We've got a great one, like we mentioned, on povidone iodine with Dr. Jeremy Forrest. We've got Dr. Allen's been on there several times. All sorts of great recorded CE webinars that you can check out. And then also video series where we again, worked with you, Dr. Allen, and that kind of helps really make that caries risk assessment and those conversations kind of explains it really easily for people. We've got a whole video series with different tips and how you can have a conversation with a patient if they're a pediatric patient or a high risk patient. There's all sorts of different options. And then also on that resource page, you'll find some of the tools that we have, like that simplified caries risk assessment form. So it makes it very attainable for someone to look that form over and realize, hey, this is not going to take that much time, and I can implement this with my patients. And if you need any help, that's what our preventive care consultants are there to help that you and your staff do. So definitely check us out at elevateoralcare.com.
Perfect. Well, thank you so much. And I'm so appreciative of you and Elevate walking the walk and talking the talk. It seems like prevention is something that everyone likes to talk about, right? Like, oh yeah, it's really important to prevent dental disease. But that, that might be as far as it goes sometimes. And I think you all obviously really believe in that, and your work and your effort and your innovation and all the stuff that you're doing in this space really shows your deep and profound commitment to it. So thank you for that. It's certainly something that we all need in our profession. Really grateful for you, and really grateful for Elevate. So thanks for joining us today, Hayley.
Thanks, Dr. Allen. Thanks for having me. And we're also just so thankful for you and everything you do for the industry as well. So thanks so much.
For sure. Have a great one.
You too. Thanks.